For as long as I can remember, I've talked about having breast augmentation surgery, but it wasn't until two of my co-workers, who are both registered nurses, had procedures done by Dr. Herring and recommended him, that I finally called and made a consultation. Well, being a registered nurse myself, I knew that there are risks as well as benefits that accompany the elective plastic surgery, and my anxiety level was a little bit high. But the very first visit, I was greeted in such a warm and friendly, professional manner that all that anxiety began to melt away. At my initial consultation, I received all the time in the world to ask questions, and we addressed the type of surgery that I would be having, and also the type of different type of implants. I was given a ton of verbal information as well as printed information that I could take home and read. And I just love that I was never felt pressured to go through with the procedure. But after that consultation and all the time that was taken with me to answer my questions, I was already ready to schedule surgery. So next came my pre-op visit. And when I walked into the office, I realized for the second time that it wasn't full of people waiting to be seen. Dr. Herring does not overbook, and that gives him plenty of time to take with each of his clients. I love that I was given not only pre-op instructions and prescriptions, but I was also given my post-op instructions there at the pre-op visit, and that meant a lot to me because everyone knows day of surgery you might be a little bit druggy and not able to read all that information. It's nice to know what you're going into before the procedure ever takes place. I also like that I was assisted with some financial information so I could actually pay for the procedure over a period of time. On the day of surgery, I have to say that I was more excited than worried because I had been given so much opportunity to ask questions, to already have addressed my expectations and what we thought our outcome would be. But as a nurse who attends deliveries, C-sections in the OR, I had a little bit of anxiety over what the operating room might look like, being that it was in the office. Now, I was really grateful that I didn't have to go to the hospital or to an outpatient surgical clinic. However, in my mind, I'm just like, what does this OR really look like? Well, let me assure you, when I walked into the operating room, I saw that it was well equipped and it was spotless, and I had absolutely no fear. I remember talking to Dr. Herring and Maria and the anesthesiologist, and the next thing I remember is I was being wheeled into the recovery room. I was pain-free. I didn't remember a thing, and I was very happy with the outcome, even that early post-op. I also really appreciated the fact that my husband received post-op instructions, so it wasn't just on me to know what to expect, but he also had that. Now I am 13 days post-op, and this is my fourth follow-up visit. To me, that's very impressive. It just tells me that I'm not just another client, or I'm not just a paycheck to Dr. Herring, but that I'm actually a valued client, someone that he cares about, and he follows up very closely to make sure that your expected outcome is being achieved and that you're not having any problems. If I could sum up Dr. Herring's practice in one sentence, it would probably be that I am completely confident in not only Dr. Herring's knowledge and his skills, but his desire to achieve my optimal expected outcome. I just find it incredible that there is a practice of this caliber right here in Fayetteville, North Carolina. And I just want to encourage you that if you're considering any type of plastic surgery, that you go ahead and you call and you make that consultation. I promise you will not regret it.